Technical Veterinary Learning Channel, honored by Professor Ahmed Mamdouh Sharif, Professor of Epidemiology and Infectious Diseases, the ex-head of Department of Veterinary Medicine, the ex-Vice Dean of Faculty of Veterinary Medicine, Bani Suef University, Egypt, presents today series of epidemiology to be completed. The second part of Principles of Prevention and Control of Infectious Diseases. A cause. Webster Dictionary defines a cause as something which has an effect. That means the cause that leads to occurrence of different results because of its existence. Word a cause in epidemiology considered to be something that alerts the frequency of a disease, health and production status, or associated factors in a population, either animals or human populations. A disease concept. A disease means a drainage of functions of any body or some parts of this body or any organ of this body from its normal functions by means that a deviation from normal functions and purposes of the organ or part or of whole body due to occurrence of an external factors cause the word a disease. Disease is a Latin word. Morbus means absence of health signs. This picture of a calf infected by warts as a viral disease of skin in ruminant. This means that absence of the health signs of skin and appear of a morbus or a disease naming warts. Disease, Latin words of morbus, in humans means that a physiological or psychological dysfunction. This picture showing high temperature with flu-like. That means that this person feel that he is catching corona, and so psychological dysfunction in his brain taking place through his side. The timeline of natural history of disease. Natural history of disease refers to the progression of a disease processes in an individual or animals over a time, in the absence of treatment or proper control. For example, untreated infection with HIV causes a spectrum of clinical problems beginning at the time of seroconversion, primary HIV, and terminating with AIDS disease and usually deaths. It is now recognized that it takes 10 years or more for AIDS to develop after the first seroconversion case. The other example is the COVID-19 pandemic. Appearance of new strain of the coronavirus as SARS-CoV-2 in Wuhan zone in China at late of November and the beginning of December 2018, and due to lack of knowledge about the characterization of this virus, it make local epidemic in that country. but due to lack of informations, economical and political reasons, delaying in announcement about the infection by WHO as pandemic of corona caused the global disaster nowadays. So between the beginning and the primary corona case and the pandemic, it is a time. So the world will suffer for several years from now from the reflection of SARS-CoV-2. This diagram will be used to explain the process of timeline of natural history of the disease. The process began with appropriate exposure or by accumulation of different risk factors that sufficient for the disease process to begin in a susceptible host. For an infectious disease, the exposure is a pathogenic microorganism. For cancer, the exposure may be tobacco smoke or another determinant that promotes the process such as estrogen for endometrial cancer. So, a stage of susceptibility is explain the availability of susceptible host for occurrence and affected by different risk factors. The other stage begin with exposure to the different examples as smoke or pathogenic microorganism or hormonal increases. After the disease process have been triggered, pathological changes then occur, but without appearance of any signs or symptoms of the disease. This stage is the stage of subclinical disease. It extends from the time of exposure until onset of the symptoms. This time is usually called the incubation period for infectious diseases and latency for chronic diseases. Incubation period, as an example, for equine influenza take about 2 weeks, and for brucellosis as a chronic disease take about 1.5 or 2 years. For cancers in man, it may be lifelong, reach to 50, 40, or 60 years to appear. During this stage, the disease is said to be asymptomatic, no symptoms or inapparent. This period may be a brief as a second for hypersensitivity and toxic reaction to as long as decades for certain chronic disease. This example is clear with Streptococcus equi infection. At the end of the disease, there is hypersensitivity occur to the animal. Even for a single disease, the characteristic incubation period has a range. For human, typical incubation period for hepatitis A is long as 7 weeks. Although the disease is not apparent during the incubation period, some pathological changes occur in infected or affected animal or person and could be detected only with laboratory radiology or screening methods. Most screening programs attempted to identify the disease process during this phase of its natural history, such as single intradermal test for detection of tuberculosed animal, Ross Bengal test for detection of brucellosed animals, since intervention at this early stage is likely to be more effective than treatment given after the disease has progressed, or control intervention at these early stages after detection of positive cases of brucellosis or positive cases of tuberculosis is more efficient than still the disease make a mess in its place. The onset of symptoms marks the transition from subclinical to clinical disease. Most diagnoses are more made during the stage of clinical diseases. In some animals and people, however, the disease process may never progress to clinical apparent illness. In others, the disease process may result in illness, such as during tuberculosis, the disease process and affect most of the organs in the animal. It take about 2 years. Cancers in human take more than 40 to 60 years to appear. So the disease here is clinically inapparent, but the pathological changes occur inside the animal or person. The disease processes may result in illness that ranges from mild to severe or fatal cases. This range is called the spectrum of the disease. Ultimately, the disease process ends either in recovery or disability or deaths. For an infectious agent, infectivity refers to the proportion of exposed animals or persons who become infected. Pathogenicity refers to the proportion of infected individuals, either animal or persons, who develop clinically apparent disease. Virulence refers to the proportion of clinically apparent cases that be severe or fatal. Because a spectrum of disease can include asymptomatic and mild cases, the cases of illness diagnosed by clinicians or veterinarians in the community often represent only the tip of iceberg. Many additional cases may be too early to diagnosis or may never progress to the clinical stage. Unfortunately, affected persons or animals with inapparent or undiagnosed infections may nonetheless be able to transmit infection to others. Such persons who are infectious but have subclinical disease or inapparent infection, persons with coronavirus can transmit the virus for about 37 days. Measles and hepatitis A and several other diseases become infected within few days. Tuberculosis take long time until opening of the sequestrum in the lung of affected animal, and this may take 1 year or more. Appearance of brucellosis and infection to another animals, it take the time of animal to come in puberty and then pregnant, by means that appearance of the brucella organism again after its entrance in the animal, it take about 2 years. However, carriers may also be persons or animals who appear to have recovered from their clinical disease but remain infective. The challenge to public health and to veterinary medicine workers is that their carriers, as coronavirus infection in the medical staff is the higher than the other person. Brucellosis between veterinarians is higher than the normal persons in the community. Work in tuberculosis farm is more dangerous for veterinarians than work in tuberculosis hospital. Surveillance. It is a word taken from French language where half of the word sur means over and veiller means to watch. By means that it is a watching over an area, over an population, over all the causes and risk factors that leads to a disease. Surveillance means the close and continuous observation of one or more persons, the epidemiologist, for the purpose of direction, supervision, or control of diseases. Different surveillance information usually obtained from: number 1. Reporting data about identifiable disease such as Ebola third epidemic in Uganda ended at the 1st of May 2021 as elaborated by WHO in the last week. Increase infection and mortality rate by SARS-CoV-2 COVID-19 at India since last of April 2021. Decrease infection rate of lumpy skin disease in Egypt at the first quarter of 2021 due to continuous vaccination campaign done by veterinary authority. This reporting data is an important information for count on surveillance of any infectious disease. Different surveillance information usually obtained from: second part is the data based on laboratory results, such as decrease of polio infection throughout the world since last decade by continuous detection of negative samples in manure, complete disappearance of cattle plague throughout the world since millennium as the virus not isolated or detected since that date. Different surveillance information usually obtained from: third part is the data of the population, either human or animal, usually is the basic information that help in estimation the occurrence, distribution, presence of different clinical pictures throughout the personnel of any population. Generally, surveillance aim to: number 1. Demonstrating the absence of a disease through disappearance of clinical pictures, negative samples, or absence of the pathogenic risk factor. Number 2. Determining the occurrence of distribution of a disease by counting the number of individuals, either animals or human, that catch the disease, areas that shows the disease. Number 3. Detecting as early as possible exotic or emerging diseases by continuous monitoring the different diseases inside the country or the region, as well as outside the country, at the borders, or as notifiable by OIE organization or WHO organization or any local authorities anywhere in the world, as distance now measured by time, not by kilometers or miles. So, pathogenic risk factors appearance at any part of the world can reach to the end of the world within cargoes, within aeroplanes, or by ships. So, veterinary surveillance is a special component that necessary to detect diseases, monitor diseases, trends, and control zoonotic and exotic diseases all over the country, the region, or even the world. Purpose and characteristics of surveillance. The main purpose of surveillance is to detect changes in directions, trends, and distribution of any disease, such as last epidemic of African horse sickness disease in East of Asia at the third and fourth quarter of 2020 which leads to deaths of 7,000 animals. For example, the objective of surveillance for tuberculosis might be to identify persons and/or animals with active disease to ensure that their disease is adequately persons treated or animals eradicated, and for such an objective, data collection should be sufficiently frequent, timely, and complete to allow effective treatment and/or eradication programs. Number 2, alternatively, objective might be to determine whether control measures for tuberculosis are effective, and to meet this, one might track the temporal trend of tuberculosis, and data might not need to be collected as quickly or as frequently. So, collectively, surveillance for a health and/or veterinary problem can have more than one objective. Surveillance application. Alexander Langmuir, 1963, who firstly applied the surveillance for a disease to mean the continued watchfulness over the distribution and trends of incidence of a disease through the systemic collection, measure, and evaluation of morbidity and mortality reports and other relevant data of any disease. Surveillance of several diseases, such as foot and mouth disease, lumpy skin disease, blue tongue, caseous lymphadenitis, malaria, poliomyelitis, influenza, and/or hepatitis. Surveillance has been extended to every part of the life, even to non-communicable diseases and injuries, as well as to their risk factors, such as drugs addiction, float, rush hours of traffic, ADHA in different sexes and ages, and etc. Surveillance of any problem does not include actions to control this problem, but the essence of surveillance is the use of data to monitor health and/or to veterinary problem to facilitate their prevention or control. Data and interpretations derived from evaluation of surveillance would be useful in setting priorities, planning and conducting disease control program, as well as in assessing effectiveness of control efforts, such as making an frontier vaccination of African horse sickness at the border of Egypt between Egypt and Sudan for about 200 kilometers to prevent introduction of this disease from Sudan, as well as the frontier vaccination of Sinai in case of occurrence of lumpy skin disease in the occupied Palestine, as well as zone vaccination of PPR in case of appearance of this disease in any area throughout the Egypt. For example, identifying geographic areas or any, either for animal or human populations with higher rates of disease, can be helpful in planning of control programs and targeting the intervention and monitoring the temporal trend of the rate of disease after implementation of control efforts, such as foot and mouth disease in United Kingdom at millennium and 2001, second Ebola outbreak at 2020 in Congo and Uganda. Qualities of persons that mean epidemiologists. Conducting surveillance should be to do the following. Number 1. Identify, define, and measure the health problem of interest. Collect and compile data about this problem, and if possible, factors that influencing it. Number 3. Analyze and interpret these data. Number 4. Provide these data and interpretation to whom responsible for controlling the problem. Number 5. Monitor and periodically evaluate usefulness and the quality of surveillance to improve it for future using. Both objectives of surveillance has been determined. Critical characteristics of surveillance are usually apparent, including timelines to implement effective control measures, representations to provide an accurate picture of the temporal trend of the disease, sensitivity to allow identification of individuals with disease to facilitate treatment, quarantine, or other appropriate control measures, specificity to exclude individuals not having the disease. How to select a health or veterinary problem for surveillance. Because of conducting surveillance for a health problem or veterinary problem consumes time and resources, taking care in selecting them for surveillance is critical. Number 1. According to country's priorities and health situation, selection is based on criteria developed for arranging diseases, morbidity, and mortality data, knowledge of diseases and their geographic as well as temporal pattern, and impressions of public, economical, and political concerns, sometimes augment with surveys of general, public veterinary, or non-health associated governmental officials, such as control program for tuberculosis in Egypt will cost billions of dollars if it done all over the world at once. But by making the country for different regions, we can do the program of eradication of tuberculosis from region one by one, so the billions will be divided on the years of eradication program. Criteria developed for selecting and prioritizing health problems for surveillance, including the following. Number 1. Public health and or veterinary importance of the problem, such as polio problem in children or lumpy skin disease problem in animals. Incidence and prevalence of the choice disease. Severity, sequelae, and disabilities that occur due to the occurrence of these diseases. Mortality caused by the problem. Socio-economic impact of the disease on the personnel of the country. Communicability between the authorities and persons. Potential for an outbreak. Public perception and concern and international requirements for control of any disease to prevent its introduction as emerging to other countries. Ability to prevent, control, or treat the health and or veterinary problem. Preventability and control measures and the treatment of the diseases. Capacity of health and or veterinary system authorities to implement control measures for different diseases. Speed of response against any emerging disease. Economics that cost the control and or eradication of any disease, availability of resources, and what surveillance of this event requires. Series of principles of prevention and control of infectious diseases to be continued.